Well, happy Mother's Day weekend. For this weekend, we have a little bit of a disturbing topic, early menopause. I know I will be devastated if early menopause hit me. But why does it happen? How does it happen? All these questions we bring MD today. Dr. Katipally is a physician, not only a physician, but he is a lifestyle medicine doctor as well as a patient advocate who himself successfully lost over 40 pounds to improve his health. I am so delighted and excited to have him with me today. Thank you so much for joining me.
Thank you, Amita. Good morning. Yeah, thanks for inviting me.
So let's just start with what exactly is early menopause?
Oh, yeah, we hear the word menopause. It's nothing new. And then the idea and concept, we always talk about the symptoms. But typically, when you talk about menopause, unfortunately, unlike a lot of other, experiences in life, it's a long, journey. And then by definition, your last, you may say, last day of your last menstrual cycle, that would be the point, in time, you call it menopause, but you wouldn't, define that, mark that until, you don't have any more periods for 1 year. So that would mark a time in your life as a menopause. Typically, we see somewhere around ranging from 45 to 55 years of age. That's the typical age, with 51 being 51 years old being the average. Anyone getting the menopause, attaining menopause before that, by definition, would fall into this early menopause.
And why is that a concern? And the cause of the early menopause, that's the other thing.
Right. Sure. Obviously, I mean, nobody wants to get into that. I mean, it's invariably one day, you need to get into that phase as a woman. That's part of life, in a phase of life. But yeah, the menopause is not just hot flashes or night sweats. It's a very diverse range of symptoms. It could range from the mood or your emotional tone and all that. But the biggest one in terms of medically speaking, clinically speaking, that increased risk for your osteoporosis and for your cardiovascular disease and so many other things. And once you achieve menopause, that itself is a risk factor for diabetes. And then you don't want to get into that phase early on for whatever reason, because it affects your quality of your life. Because let's say if someone gets a menopause in their late 30s, wow, that can be devastating for their family life, personal life, and sexual life. It can be work. There's so many ramifications. So it's really critical to kind of look out for that and see what we can do about it. And then thank you. I think you said the reason or the causes. Wow, why do someone get early menopause? Well, I think you can think of the genetics always plays a role. I mean, family history in terms of when you get your menarche, the first period, or menopause, and so forth. So obviously, it's a family history. What your mother or your female siblings have gone through. And for a variety of reasons, iatrogenic, meaning if you get the oophorectomy, if you get your ovaries taken out, for different reasons, obviously that end up losing your hormones, so menopause. And then lately, unfortunately, we see so much of cancer around. It's a second leading cause of death, and cancer requires radiation and chemo. That itself can put your ovaries at risk. And then a variety of reasons. Today, as you brought up, thanks for inviting me to kind of put diabetes in relation to early menopause. As we know, diabetes has it's a true pandemic, honestly speaking, and more cases of diabetic patients we're seeing getting into the menopause early on, so to speak. So I think diabetes is one of the leading causes for the early menopause. So we really need to be paying attention to that.
Yeah, absolutely. So I was actually reading a lot of research, especially I want to bring in the cultural aspect of it. India being a diabetes capital, right? So not only Indian women have a lower age for reaching the menopause, that's 47, 48, as opposed to other women. Well, here in America, for example, 51. I'm not an expert. I just and then the diabetic women, 44. So now the diabetes in women, if you can prevent it, right, using your lifestyle medicine, you can also hopefully prevent early menopause. So talk to us about diabetes, different type of diabetes, and can they be preventable or not, managing your lifestyle medicine, and of course, as a result, the menopause, early menopause?
Absolutely, absolutely. Well, yeah, the incidence and the prevalence of diabetes, they just, besides obesity and a lot of other metabolic diseases or lifestyle related diseases, it's pretty disturbing. And then you can look around. It's not just one or two people around. Either you yourself or diabetic or pre-diabetic, or your siblings or your family members, or you don't have to look for a diabetic patient around. And the global incidence is rising, and then here in US, it's pretty high. 1 in 3 are pre-diabetic, 1 in 6 are diabetic. And as you just mentioned, India, unfortunately, of course, we host. It's now not the second most populated anymore, the first most populated country in the world. With that population, we do have millions and millions of cases of diabetics. Still, China holds the highest number of diabetic cases. Next falls the India, and then comes the US. Here we have 30 plus million diabetics in this country. So when the incidence and prevalence rate are increasing, and leading to this early menopause, I think it becomes really important in women's life. The reason being, diabetes is not just a simple high sugar condition. It's a very complex metabolic disease. Not every human being's physiology is same. Not every diabetic is same. Even within a given time to time, from phase early on, from first 5 years to 10 and then 20 years down the road, their body physiology changes. And then on the same in the same way, menopause is not a simple a transition either. There's so many complex hormonal transitions happening. There's back and forth and ups and downs. So both intertwined together would make it a little complicated course for a given woman.
All right. So talk to us. This is a quick 10-minute session that we bring on a daily basis. This is not a medical advice just because we have MD. So talk to us about prevention of diabetes using lifestyle medicine, and also what your company, you're offering lifestyle medicine. What is it that you're offering?
Okay. Well, thank you. Thanks for asking that, because even though it looks like a big monster, it's like as if nowadays, when I talk to my friends or colleagues or even patients, well, I have that family history. With this 2-3 generations of population getting this diabetes, so it's not unheard of. So as a result, there is always a family history. It's either your parents or your siblings, there's some, or grandparents. So even all three generations actually have diabetes. So that itself is daunting. And then more and more obesity and diabetes is seeing around. So it has become, I think society has come to a point where people are taking it for granted, as if this is going to be, I'm going to get diabetes, at some point in my life. And then we are not waiting to see diabetes in 50s and 60s anymore, 40s and 30s and even 20s. And it's what's most disturbing is actually the childhood obesity is on the rise, and then childhood pre-diabetes and diabetes are on the rise too. When I talk to my pediatric colleagues, they say, oh yeah, we started writing metformin that we used to write for diabetics. And then before that, the kids are, graduating from high school, some of them are ending up on metformin, or they are, pre-diabetic. So there's so much incidence. It just desensitized the community. Like I said, as if everyone is going to get, will get diabetes at some point in time, and then we can't do anything about it for family history reasons or societal reasons. I can't change my lifestyle. I can't change my diet. No matter what, I'm going to get it. So as a result of that desensitizing status, people don't usually think about taking measures to prevent it, let alone reversing it. And the reason I say that is there's more and more evidence. The research is that there's growing body of evidence showing that thousands and thousands of cases, not just prevent and reversing the early stages of diabetics. Established cases of diabetics actually they're getting their sugars and A1C back into the normal range to reverse the diabetes. So especially the insulin resistance, the type 2 I'm talking about. So I want everyone to be aware that this is not just preventable, even reversible, meaning prevention should be taken seriously. And even if you end up, getting the diagnosis, there are ways to handle and mitigate that and improve your insulin resistance through lifestyle interventions. As a member of, ACLM, American College of Lifestyle Medicine, and board certified lifestyle medicine physician, we strongly advocate that, pay attention to your lifestyle. And through our 6 pillars of lifestyle, your eat, move, and sleep, your nutrition, your regular physical activity or exercise, proper, sleep and stress management and avoiding certain substances, high risk behaviors, and then stress management, so forth. So it is manageable. And as a matter of fact, after my 12, 15 years of my practice, this is I'm onto something new. After learning that this is not just that there's a better way to manage our diabetic patients and prevent it. We launched our new clinic and program here in San Antonio. Our clinic is New Me Health because that's our mission, to kind of transform lives, not just treating diseases. So it is preventable, and it's even in established cases to a certain extent, insulin resistance can be reversed.
Okay, so I forgot to ask you a scientific question.
Sure.
Is that the reason where the women who are diabetic, why do they get early menopause? What is the relationship of the diabetes with the ovaries is what I'm trying to get at, right?
I see. Sure, sure. And I think that's definitely $1 million question. I think I'm not sure if we have the clear cut answer or the evidence, but like I said, the diabetes is a very complex metabolic disease, and the central obesity and insulin resistance are certainly the driving forces. And then when you're diabetic, I think it's invariably we might be a little bit we need to be mindful of other lifestyle risk factors that might be influencing. So I think it's a multifactorial, but the evidence is clear that people getting diabetes type 1 before around the 30s, and then type 2 in the later part of the 30s are not just likely. We are seeing more and more evidence of getting into early menopause.
Okay, so I think the message is to really improve your lifestyle, right? To your point, and if you change your lifestyle and not, try to reverse your diabetes, not by taking only metformin or other things that we talked about, stress. That's a completely different topic. Then the chances of early menopause are diminished, and the data, right? So that's what the conclusion is. Do you want to conclude some things? What women who will listen to this talk they should do as far as changing their lifestyle?
Absolutely. I mean, like I always say, that the lifestyle interventions, basically whole food plant-based nutrition, because if we just ignore how powerful the food is medicine, and the plants are the mother nature as a bounty. Um, and then we must pay attention to that. And then the regular physical activity, and then strain or sleep management, because one day of bad sleep can affect your sugars for 3 days, and then the stress hormones. So these are all the intertwined, and then in a complex mechanisms play a role. So by preventing your diabetes and managing better, you're not only controlling and managing the diabetes, but you can eventually you can actually minimize getting into this early menopause. And there's actually a great book by my favorite, Dr. Neil Bernard, Your Body in Balance. He talks about hormones and then all the women's health and then diabetes prevention through whole food plant-based intervention. And then there's lots of data, how regular physical activity, cardio and strength training can help you in multiple facets. So a lifestyle intervention is the way, and that's how we designed our 6-month program. We call it Defeating Diabetes through these interventions, whole food plant-based and regular physical exercise. We have dietitian on board, different meal planning. It's a very methodic and structured immersion program. They're fully engaged. They have one-on-one visits and then weekend sessions and group sessions. As a matter of fact, we just had one in a workshop this morning. So it's a complex course. So people need attention and then need help and support. We use different state-of-the-art technology to monitor their sugars, their other biometrics. So they learn from their own journey how their transition in food and exercise is directly affecting their sugar levels and their insulin resistance, in a matter of days and weeks. So it is doable, and then they can learn more about our program, by going to our website, newmehealth.us, newmehealth.us, and then we'll be more than happy to help them. But this is something. It just the message is out and loud, that you go to every women listening to this, that managing diabetes and preventing it is the one step closer to preventing your or minimize or avoiding your early menopause.
All right. Well, thank you so much. This is a quick 10-minute session that we bring on a daily basis. Today's message is clearly it's easier to defeat diabetes than early menopause. If early menopause is gone, there's nothing defeating it. I'll tell you that. So get on the bus of a lifestyle medicine. and have a great and happy Mother's Day. Thank you. Thank you so much.
Thank you. Thanks for inviting us. Okay. Happy Mother's Day, everyone.